Alright, today we're going to talk about gowning and gloving for a dental surgical procedure. Even though the mouth is not sterile, we still want to apply good OR operating room policy and technique to gowning and gloving. So most dentists and dental staff don't really get this training. I happen to be a surgical technician, worked in OR, scrub tech for about 7 years, so let's talk about it. First thing is no watches or rings, no jewelry, mask is on, head bonnet, glasses, whatever you're going to wear. And so we're going to use a surgical scrub, which is already impregnated with the surgical soap. And it's important not to have long fingernails when you're gowning and gloving. So we're going to soap up real good, and you want to have at least a 3-minute scrub. And when you are scrubbing, you want to make sure you get your fingernails. There's a little brush right here. I don't know if the camera can see it. But you want to scrub real good with the brush side first. And then you're gardening the day before. You want to make sure your fingernails are real clean. And you want to scrub down in dentistry. You want to scrub down, down the forearms, about like this. Okay. Now maybe in surgery you might go in a little bit farther if you're working OR, but in the mouth, this is pretty good for us. So now we're going to assume that 3 minutes has gone by. We're going to drop the scrub brush, and we're going to rinse from fingertips down toward the elbow, fingertips down toward the elbow. And we're going to improvise and use our elbow here. Now, shake it off. Hands need to be up like this, okay, so that the water drips down your elbows. Now, it's important, we're going to walk into the dental operatory. And so, we've already laid out surgical gown and surgical towels. So I'm going to very cleanly pick up the surgical towel. We're going to open the towel, and we're going to put our one hand behind the towel. We're going to use 1/2 of the towel. We're going to dry from the fingertips down toward our elbow like this. Then we're going to grab the bottom side with our hand behind here. And we're going to, again, dry from fingertips down. And my hand is behind the towel to make sure that I don't touch my skin. And this is going to be thrown into a bucket off the field. We're going to air dry just a little bit. Then we're going to very cleanly pick up our surgical gown, which is always folded with the inside of the gown. We're going to step out in the hallway. We're going to shake the gown down, making sure that we don't hit the walls or anybody else with us. We're going to slip in, and we're going to bring our hands up into the cuffs, and we're going to hold on to the cuffs. And we're going to have a second assistant come behind me, and she's going to pick up shoulders. And again, we're all wearing masks. Heads, and she's going to just lightly touch the back there. And then there's an inside tie, and she's going to just gently tie that in a bow. All right, and then she's going to step out of the way. Now we're going back in the treatment room to put our gloves on, and hands need to be kept inside. Follow me. So we can now pick up the gloves that are on the sterile field. And we'll see there's an R and an L on the surgical gloves. And we're going to pick up the R with our hands inside the cuffs. And when we pick up the R, I'm going to grab the glove where the thumb is. Here's the thumb, and I'm going to grab the cuff next to the thumb and lay it in the palm of my hand, just like that. Now then I'm going to use my pincher over here in this left hand, and I'm going to grab the other cuff, and I'm going to pull it over. And then I'm going to use this hand, and I'm grabbing both the gown and the glove at the same time, and voila, you have your hand in the gown. Now, this hand is a sterile hand. I can reach over and get the left glove. And again, I'm grabbing it where the thumb is, and here's the thumb right there. Grabbing the cuff where the thumb is, laying it in the palm of my hand, thumb to thumb. Now I'm going to pull this cuff over. And as I do that, I'm grabbing both gown and glove, and then I pull my hand up through the gloves together, and we've secured our gloves like that. In the operating room, in surgery, what's considered the sterile field is elbow to hand, nipple line to belly button. So that you can't touch up on your shoulders, down your lap, only from elbow to hand, elbow to hand. This is considered. That's why you see on TV, you see everybody holding their hands like this, okay? You never drop your hands down by your side. You can't reach up and scratch your face. You hold your hands here, okay? Now with the gown, there's also a wraparound tie. So I'm going to very carefully, and this second assistant be careful. You see there's two colors right there? She only touches the purple and she holds it firmly. I'm going to gently, slowly turn. She does not let go. I will pull this, then I will secure this with a tie. So that's how you gown and glove in a dental office.